Gonorrhea, chlamydia, we do see chlamydia, yes. Syphilis, it seems to be on people's minds. So we get people coming in who say, oh, I woke up with a ladyboy, I made a mistake, it'll never happen again.
Hey folks, Pete here from Thairish Times. What's the story horse, as we say in Dublin, Ireland? Now I know a lot of you are waiting for Paul Wallace Part 4, and it is coming in the next couple of days. I will release Paul Wallace Part 4, which I actually think is better than the first 3 that we filmed with Paul. Alright, I got loads of Instagram messages, loads of emails saying, Pete, come on, we want to see Part 4, I want to see Part 5. We got 2 more coming with Paul. But first, I'm going to release this video with Dr Donna Robinson. If you've been following the channel, you'll remember that about 6 months ago I interviewed Dr Donna Robinson. I asked her about the rate of HIV in Thailand. And we also discussed her business in Thailand, because she has a really successful clinic here in the city. So we're going to have a chat with her this time about STIs in Thailand. We're also going to talk to her about the common medical problems that tourists have when they come over to Thailand. And then I asked her about mask wearing, because right now a lot of people in Bangkok and Thailand, well mostly Bangkok, are wearing masks outside everywhere you go. You could be in a park like this and you could have no one around you and you're wearing a mask. And I asked her kind of what does she think about that? What does she think about mask wearing? So that's what we're going to get into as well. Oh, and one more thing. Dr. Donna is in the process of becoming a Thai citizen. And that's pretty interesting, because it's very hard to get. There's not that many people that I know that have Thai citizenship, that are foreigners, that is. So without further ado, folks, let's go meet Dr. Donna Robinson, have a chat with her. And if you're not already subscribed, hit that button. We're nearly at 20k. I can't believe it. 20k, baby!
Dana! 60 G's, baby!
Fantastic. We're not far away. I need your help to get there. Hit the like button, subscribe to the channel, leave me a comment what you think, and let's go meet Dr. Donna. Dr. Donna,
Hi.
we're back again. Nice to see you again.
Morning, Pete.
Morning, Dr. Donna.
Yes.
I feel very in a formal setting here in a doctor's clinic. Last time we spoke about the rate of HIV in Thailand, and we also spoke to you about your business and stuff like that. We'll get into business questions again, because you do have some interesting questions I didn't ask from the last time. Okay, so let's talk about STIs. Thailand has a sex industry. Okay, we all know that. Everybody watching this knows that. So it got me thinking, the STI rate here, it has to be higher than other countries.
From what I've seen, STIs are because we see a lot of people from other countries, and they've often had an STI in another country where maybe they've had free tests, free treatment, and so they know. And I think there's a lot of awareness of having tests and treatment too, and maybe people are more responsible these days because they do want to have the tests, but there's a lot of fear, embarrassment, and I think that's where we can help.
So what's the most common STI you're treating here in your clinic?
Well, things have changed in the last few years. I would say we're seeing a lot more of mycoplasma, ureaplasma, mycoplasma genitalium, and ureaplasma ureolyticum. These are what was thought to be emerging STIs. Gonorrhea, chlamydia, we do see chlamydia, yes. We do seem to see less gonorrhea. And syphilis is always, it seems to be on people's minds because they're searching on Google, but actually it's very rare.
And what percentage of your clients are you treating for STIs?
Oh, I would say about 20%. And the beauty is that people can come in and say, oh, because they come for the consultation, I've got a rash, or I've got a hand problem. So of course they come and see me, and then they say, actually I didn't really want to give any information. I'm worried I could have got a sexually transmitted infection.
And what's the worst case you've ever treated?
What's the worst? Well, people are still incredibly distressed with genital herpes. People can cry, they can be distressed. Does it mean a life sentence? But we reassure you, genital herpes can be treated and prevented, and you can test between, I hope I'm not sounding like a doctor lecturing, but there's the common herpes cold sore, often type 1, or the genital type 2, but now we're seeing a full mixture. So people do want to know, is it type 1, is it type 2? But it's completely treated, but the distress that we see people having with genital herpes is still enormous.
So what advice do you have for people who are going to partake in the sex industry here in Thailand?
First of all, read as much as you can. Everything can be prevented, and I think in Thailand too there is awareness. And for example, now there's PrEP on demand. So we get people coming in who say, oh, you know, I woke up with a ladyboy, I made a mistake, it'll never happen again. And you just, of course, as a doctor, your question is just to listen. It's not to say, well, what happened? No, you just listen. And you know, we want to give people information. You can prevent HIV. There's PrEP on demand, taking 2 tablets, 2 to 24 hours before you have sex, and then another 2 tablets for 2 days afterwards. But people always say, oh, but this will never happen again. But you just have to make people feel, look, reassured, and look, it doesn't cost much. It's like 700 baht to buy a bottle of PrEP to prevent HIV, and it's widely available.
What are the big issues that tourists find themselves in, medically speaking, in Thailand?
Tourists, well, I guess they used to have a lot of accidents when they were having fun all over the place. Motorbike accidents, of course, is number 1. Other people can forget their medication. The older group of people, probably like me, and people still have common problems like coughs and colds, gastroenteritis, and they always wonder if it could be something weird, and they always say, will the doctors speak English at the hospitals? A lot of what I think I'm doing is reassurance.
What about monkey bites? Because every time I go to the islands, I always see loads and loads of monkeys, and I really like monkeys, and I go over and I film them and I take photos of them. And my wife Noon is always saying, don't get too close, because if they bite you, you're gonna get an infection. And I'm just thinking, how dangerous is a monkey bite? Yeah, monkey bites, I think they are common. In fact, some weeks we've seen more monkey bites, or some months, than any other kind of animal bite. So beware. Do they get infected?
Well, any bite can get infected, but what anyone is worried about with an animal bite is the risk of rabies, because rabies is fatal. But for reassurance, everyone usually goes and has the rabies vaccinations, which is widely available and not expensive.
Question that I've often wondered myself, okay?
Yeah.
Someone gets sick, they have an accident, could be a motorcycle accident, or they get sick, they go to hospital and they don't have insurance, or their insurance doesn't cover them for the cost of the medical. What happens then?
Well, what happens, first of all, in a government hospital, which everywhere, in every province, Phuket, Chiang Mai, wherever you are, Mae Hong Son, there's a government hospital that will give you good treatment at a reasonable cost. And I think too, the private hospitals out of Bangkok are similar. So you'll always be able to afford treatment. And the treatment anyhow usually doesn't cost a lot. It's not like going to an emergency room in some countries. So you should be able to afford it. All over there's some good pharmacies. The pharmacists are very good, they're very knowledgeable, and they'll really help you, because then I see people coming into the clinic, even if we get back to STIs, and they say, oh, I saw the pharmacist and he told me to take 4 tablets of this and a week's course of this. Oh, the pharmacists are very much up to date as well.
All right, so a big question now that really impacts my life, your life, everybody in Thailand at the moment. We're wearing masks outside. Okay, I'm not sure if it's official mandate or it's been lifted or not, I'm not sure. But everyone outside is wearing masks. Mm-hmm. What's your opinion on that? Do you think we need to wear masks outside?
What, is it needed? I think if you've got coughs or colds or you're near someone, you should definitely wear a mask. And I think some people will continue for a long time.
How long do you think we're going to be wearing masks for here in Thailand? Because other countries have gotten rid of them. Ireland, Germany,
I know.
America, Texas, no masks.
I think it'll change so that when you're either in a very crowded place, maybe you may consider, should you wear a mask or not? Or, as I said, if you've got a cough or cold, or if you're worried about being near someone with a cough or cold, then it could be optional. And I think that will be the good thing here. Okay. The awareness of hygiene.
Okay. I also did I also did a video where I spoke about addiction in Thailand, and a guy sent me a message on Instagram where I spoke to him on the phone, and he said that he has a problem with drinking alcohol and taking Valium, and he said that he asked me could I make a video on the problems or how easy it is to go into a pharmacy here, not every pharmacy but certain pharmacies, and buy drugs like Valium, Xanax, Tramadol without prescription.
Yeah, some of these medicines are available, but I think more and more they're being restricted. And the Thai FDA is checking up a lot since COVID, in fact. So, but I mean, in clinics we can prescribe them, but all the same, we want people to look at other medicines, you know, give them all the choices. What can you take other than diazepam? How can you, if other countries are using other tablets too, like antidepressants instead of long-term diazepam use. And again, there's restrictions here on the amount of tablets you can prescribe, because we don't want our patients to get addicted. There's a time and place for all these medicines, but it's a shame if as doctors we've made people addicted.
So let's get into the business questions, because you are an entrepreneur, right? You've created this business and you've done very, very well. You've got a lot of people out there working for you. It's a very busy clinic. So I'm interested to know, setting up the business as a foreigner, how did it work with regards the stake in the business? Because you always hear the same thing. Yeah. You know, a foreigner can only own 49% of the business, where 51% has to be in a Thai person's name. How did you do that? Well,
in fact, you can do it with a lawyer. In fact, I've got a Thai friend who has signed for things on the business, so that worked out very well, and I think he's also helped other people do the same.
Okay.
But a lawyer would set it up for most people.
Do you recommend anyone to go with a lawyer if they're going to go down that route?
Definitely, yes.
And how about online trolls? Leaving bad reviews about your clinic online, how do you handle that?
Yeah, this is something that's cropped up in the last couple of years, hasn't it? As we've become more well known, we're facing different problems. I just think most people are pretty good, aren't they? But I know as a business, you need to respond to every review, and it's a learning experience too, because why are we busier? we've got to listen to people, and the feedback some people give is really useful. I was looking at some reviews from a group I think I'm banned from, but I managed to get the reviews, and actually there was 2 or 3 reviews. One said the Botox was painful, so really that's great feedback. You know, we need to improve. We need to then look at smaller size needles, pain relief beforehand, offering every single customer eyes, listening to them.
One thing I noticed about you is that you've been able to pivot. So I've just been looking at your business the last year, 2 years. You've been doing a lot of the PCR testing, right? And imagine now that's starting to dip down. And you're looking to pivot again. What are you going to do this time?
Well, we think that general practice is a niche market. There's been a big shift, I think, since COVID. Like, you see people sitting outside in cafes now. Before, people would never go outside. They'd always want to be in the aircon. So we're definitely going to capture on the general practice. And I've got another doctor sitting in a room next to us, because we found that there's a lot of walk-in patients, and we must have not been capturing that market. So, and it makes the staff less stressed, having more doctors and nurses around, and a pharmacist.
Okay, so I understand that you've applied to be a Thai national. What's the process? You're not a Thai national yet.
I'm a resident.
Resident.
Yes. And it's surprising. I applied last year, and I'm going through lots of steps this year and interviews with the National Intelligence.
What are the steps? Can you talk us through the process of becoming a Thai national?
Well, the steps are, you probably do need a good lawyer. It's difficult to do things yourself. I think if your partner or spouse is Thai, that could be easier, but I'm married to Ian, my husband, from Scotland, but there's a lot of paperwork involved. Yes, that's why a lawyer can kind of help you smooth through the system, and you do have to have interviews and speak Thai, and even speak Thai, and you do have to sing the national anthem as well, or at least speak and know the national anthem.
Do you have to sing the anthem in front of a group of people?
No, it's with one person at the national police station.
And how long does the process take from start to finish?
It's about 2 years. You know, I kind of wondered why I didn't do it years ago, because this is my home. And more we look around Bangkok and Thailand, and yes, we feel at home here, don't we?
Yeah.
Do you feel at home?
I do. I love this city. I love Bangkok. Dr. Donna, thanks very much for your interview.
Oh, thank you.
I wish you all the best.
And I hope you get plenty of views.
Yeah, we get loads of views, Donna. We get loads of them.
I'll watch it every night. I'm going to watch every...
You just leave it on repeat, so I get all the views.
Oh, I leave it on repeat.
Just hit the play button and let it play all day.
Play it all day.
Play all the videos all day.
Okay, we'll do that. Okay.
So thanks very much, everybody. Please subscribe to the channel and leave us a comment what you think of the interview, and like, share, do all that stuff, and we'll see you on the next one.
And no trolls.
No trolls.